Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Hyperparathyroidism. We're looking at the bone findings. So here, the PTH in hyperparathyroidism, the PTH is increased, and this leads to the subperiosteal bone resorption. Subperiosteal bone resorption. And next is the hand X-ray. The hand X-ray shows the earliest bone changes, and the resorption starts classically in the middle phalanx. So resorption, it starts in the middle phalanx and of the index finger. Then comes the concave margins. The concave margins of the bone is due to the subperiosteal resorption. There is a saltpeter appearance of the skull. There is a brown tumor. This is aka the osteitis, fibrosa cystica. And this is most commonly with the primary hypothyroidism. There is also a rugged jersey, the rugged jersey spine, and this is seen in secondary hypothyroidism, and is common with the renal failure. Then comes the rugged jersey spine. This is a renal osteodystrophy, and also it shows alternative end plate sclerosis. There is a chondrocalcinosis. It is seen in secondary hypothyroidism. Chondrocalcinosis in secondary hypothyroidism. To learn and grow daily like this, please do subscribe.